Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the ViVE Conference, speaking with the industry's greatest leaders about trends in the space. So tell me, who are you and what do you do?
I'm Niki Panich. I am a women's health physician, been in practice for just under 20 years, but spend the majority of my time in health IT. So I have a master's in AI and business degree, and that's brought me to some very interesting places. My current company is a company called Pengin Ai. We are an agentic platform, which is really, really hot right now in the industry. And we serve the administrative waste that we see so much of. We're giving time back to physicians. We're giving time back to teams that are doing things like prior authorizations where they're spending time thinking instead of control F and searching. And so I think one of the really exciting things being practicing physician is I can really think about, and as we're building products, think about how do you implement them into the workflow instead of being extra steps? How do you really think about, driving value for your end users?
Oh, just love it. I love a good physician technologist, female, feminine, woman leader. So thank you for joining us today. We're so excited to learn from you. What trends are you hearing in the ViVE hallways?
There's a lot about agents, but not just about single agents. How are you thinking about an agentic solution? How are things tying together back to workflow? How are you going to implement this? What is the change management that needs to go along with that? And then what is your governance strategy going to be? How are you detecting bias? How are you making sure that you're not propagating, what's in, and we'll talk about this in women's health, but what's propagating, how are you not propagating forward bias, myths, things that exist in the data? How are you making sure you're compliant with the standards? So it's not just about cool agents, cool things. It's what is your overall strategy? The other thing that I'm really seeing is a lot more CMOs, a lot more CMIOs actively engaged, being strategic, sitting at the decision-making table, really thinking about how are we going to implement this, not just what's the problem that we're solving.
Yeah. Oh, I love it. And I'm hearing that too. So I'm so glad to hear it confirmed in you. Now, my big, topic of interest for this show is women's health. We're hearing tons of advancements in care and research and beyond. How are you seeing this in the work that you do as a women's health physician and beyond, and the work that you're doing in AI as well?
Yeah, I love this question. So I have to say, one of the biggest things that we're seeing finally is a trend towards hormones. And with the Women's Health Initiative 20-year study coming out, a couple of years ago saying, maybe did we overcall this? Should we be thinking differently about hormones? How do we move this forward? How do we start the conversation? We're seeing a lot of great companies. We're seeing a lot of great trends towards precision hormones, precision care, talking about it in a different way. There's a generation of women that did not benefit from that, and we're going to fix that. So that's exciting. We're seeing some advancements in endometriosis. The average time to diagnose endometriosis is 7 to 10 years. Women get dismissed as, painstaking. They get dismissed as anxiety. They get dismissed as other things. But it's, and so finding quicker ways to get those answers is going to be really meaningful. So I'm excited, I'm excited about that. But there's still a lot of work to do. I was talking with a colleague of mine. We were talking about residency programs and training, and it's still only a third of residency programs that have menopause training, a third.
Wow.
And when we talked about how much training, 70% had less than 2 lectures. And it's no different for breastfeeding. Breastfeeding, again, what we want to encourage women to breastfeed, we want to have their physicians encourage them to breastfeed, less than 3 hours worth of training on breastfeeding. So you can't expect physicians that don't have the knowledge to be confident in promoting. And so I think we have a lot to do in how are we training the next generation of physicians. AI can actually, help with that. It can help pull some of the new studies. It can help nudge at the point of care. I do think that, that there's a lot of potential to fill knowledge gaps and to bring forward best practice using AI and technology.
So interesting, so fantastic. We will have to do a longer episode on this topic
For
together.
Sure.
That said, while my listeners love to learn about trends in the space, they also love to hear about what drives amazing women leaders like yourself.
Mm-hmm.
So if you could give your younger self a piece of advice, what would you tell her?
Yeah, I think I would say continue to be curious. I decided to go back and do an AI degree and a business degree after about 10 years of practice. And I was so nervous about doing so. But it was fine. It was great. I loved it. And I think what I realized is, oh my gosh, I've been learning all through. We're all reading papers. We're all staying current or trying to on what's new in medicine. And so, um, and it's actually super important to have physicians that are still practicing involved in technology and new technology development. And so I think, you can help your patients one-on-one when you see them individually. And I love that. And that is a meaningful part of my week. I will never give that up. But there's a different level of scale and impact that you can have when you're building technology that can help millions of people. And so I think, doing that mind switch from I'm a physician and I will always be a physician, but I'm a physician now innovator. And, am I qualified to be an innovator? What does that look like? Do I have the credentials? Do I have the mindset? I think there was, that's the confidence that I gained from going back to school. I also think I've become more vocal. I've become more vocal as a woman for women's, for women's rights, for women's health. I actually sit on the board of an organization, venture capital firm that is called the 51% of women in the world. And so they're investing in women founders. And so we're seeing more and more trends like that. I mean, in my day, when I did my training, 96% of studies were in white men. How can you apply that to a diverse population of ages, of ethnicities, of genders? So we're finally starting to see some trends moving towards, women's studies, women's health, and we're not just, younger men. We are different, and a third of our heart attacks, 70%, depending what you read, can present very differently than men. And women often get dismissed as hysteria or it's heartburn or it's what have you. And, it could be something fatal. And so we need to build the tools. We need to study in appropriate ways so that women have the same, ability to be preventative and to be point of care diagnosed with conditions. And so I'm excited about that.
Snaps all around to that, girl. And thank you for being a part of that change.
Yeah. So I would say, my last piece of advice to myself would be confident. Be confident in your ability and pursue things that you're passionate about. Women's health has always been one for me. And if there's ways to evolve as the world evolves, do it.
Love it. You hear that? Do it. Thank you so much for joining me today. Have a great rest of your conference here at ViVE.